I've received several comments on my videos from people who recommend certain treatments for a Candida overgrowth in the digestive tract. And some of these have concerned me and are not what I would recommend. So I want to share with you some things to consider when it comes to treating this type of a Candida problem. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center. Over the years, I've noticed that many people feel that the more toxic the drug, the more likely they are to believe that it is stronger and that it will solve their problem. This is not always the case. I want to caution you about several antifungal medications that are often used to treat Candida and other yeast infections, but that I do not usually recommend for treating a Candida overgrowth in the digestive tract. Diflucan is a commonly mentioned antifungal that people often mention or ask about, and diflucan is also known as fluconazole. Diflucan is a hepatotoxic medication, and what that means is that studies have shown that it is toxic to the liver. Other antifungals that are known to be toxic to the liver include ketoconazole and clotrimazole and terbinafine and amphotericin B. There are medical reasons for using these medications in some types of fungal or yeast infections. However, I would not recommend them in most cases of a yeast or Candida overgrowth in the digestive tract, specifically there. When using these medications, it is often recommended by your doctor that you monitor your liver enzymes, testing them before you start treatment and something like every month that you are on the treatment, so that you can catch liver damage early in the process, right, while you're taking those medications, and before that liver damage progresses too far. And of course, then you would discontinue the medication. So if you do use them, I highly recommend that you do that. But when it comes to treating a Candida overgrowth in the digestive system, in over 20 years of doing that, I found that most cases require several months of treatment. And this is often much longer than the antifungal treatments are for other types of fungal and yeast conditions. And in my experience, the medications we've been discussing that we just named do not shorten this time frame, nor do they improve the outcome of my patients. And therefore, I have not seen any advantage to using them, and I feel like the risks associated with taking them far outweigh the benefits. But if you are considering any of these options, I encourage you to take their liver toxicity seriously and to work with your doctor to make sure that you use them as safely as possible. I have found that there are many excellent and safer options to treat Candida in the digestive system. In fact, many of the natural antifungals that you see on the market can be very effective and often are excellent options for treating this type of Candida. We don't have time to get into all the details about all of those and what those are, and there's a bunch, but they do exist. They're out there and you've probably seen them. And another and much safer prescription option is nystatin, which has no liver toxicity when taken orally. Now, if you need help treating a Candida overgrowth or even just suspect that you might have a Candida overgrowth, we'd be glad to work with you. And we have worked with patients all over the US and many other countries via Zoom and telemedicine. If you found this video valuable, please give it a thumbs up and subscribe to my channel for more information about Candida and other issues that affect your digestive health. Thank you for watching.